want to go ahead, just let me know. Okay. We're new to the MS Teams world. So welcome everyone to the May statewide Children's Committee. I can't believe it's been a full year now that we've been meeting electronically. So as you know, the governor's executive order was not extended, but the committee has determined that it's necessary to meet electronically due to the COVID-19 pandemic and the need to ensure a safe and healthy meeting environment. So that's why we're meeting electronically again today. I'm going to go ahead and go through the attendance. Before I get to that, though, just a reminder, if you are not presenting or speaking, please make sure your phone or your computer is muted just to prevent any feedback. This meeting will also be recorded and it will be posted to the department website within the next day or two. Also, if for any reason we have to vote on anything, I don't think we should, but if that's the case, we just need to make sure that we state our name before voting. So I'm going to go here. I'm going to go through the attendance, Ricky, and then I'll hand it over to you. So my name's Kirby Fye. I'm with the department. I'm going to go through the members who have joined via computer first, and then the individuals who have joined via phone. Melissa Birdwell, who will be presenting today and is a member. Amy Holland with the department. Avis Easley with the department. Elizabeth Reeve with the department. Glenn Gaw. Megan Gaylord, Jerry Moore, Jessica Mullins, also with the department, Carrie Virgo with the department, Lindsay Blevins, Melissa Binkley with the department, Melissa McGee, Raquel Schutz, Tammy Summers, Steve Petty. I know on the call we definitely have Kurt Hipple, who's with the department, and Ricky Harris, who's the Children's Committee Chair, Becky Brumley, who will be presenting this morning. I know that I've missed Alicia Smith-Knight, I believe, is on the call as well. Is there anyone I've missed that's joined via phone?
Can you hear me, Kirby?
Yes.
This is Hunter Hancock. I'm the new community liaison at Aim High, Tennessee.
Welcome, Hunter.
Thank you.
Anyone else I've missed that joined via phone?
Yes, can you hear me?
Yes.
My name is Raquel Morris. I'm here from Helen Ross McNabb Center. I'm program coordinator of the Children and Youth Services in Hamilton County.
Welcome, Raquel.
Thank you.
Anyone else? Oh. Okay, I'm going to hand it over to you, Ricky.
Thank you so much. Good morning, everybody. I am very excited today to have our speakers, our presenters rather, with us, particularly kicking it off this morning is Becky Brumley, and she's going to tell you about the FIT program. It's something that I became aware of several years ago and was invited to participate in some of the early strategy meetings for the work, and I was just extremely impressed with the desire to do work that was preventative through pediatric care, and I thoroughly enjoyed getting to know people in the group, particularly those from the medical field, who were just really thinking progressively about how we can begin addressing the mental health needs through pediatric care and then referring people to the services they need. So Becky, I'm going to hand it over to you if you are ready to go.
Yes, thank you, Ricky. I think you have a handout that I provided to Kirby that are some slides that I'll kind of go through. I represent the FIT program, which stands for the Pediatric Health Improvement Initiative for Tennessee. And of course, like everything else, we love to give names to everything. So for short, we call it FIT. It is a program within the Tennessee chapter of the American Academy of Pediatrics. So I wanted to tell you a little bit about TNAP, just so you have an idea of how we fit into the whole scheme of TNAP. TNAP is a professional organization that represents pediatricians primarily, but has a lot of other members, such as office managers and other medical professionals. Our primary goal is advocacy for children and pediatricians. We spend a lot of our time, our board does, and our staff on advocacy. We have lobbyists that also represent some other organizations that have strong interest in children, and spend a lot of time on the Hill, not me personally, but the lobbyists. So a lot of our time and effort is spent toward advocacy. We also, of course, if you're familiar with the American Academy of Pediatrics, they're a very strong advocate for children. So we actually meet with them once a week so that we can keep abreast of what's going on with in the nation as far as laws that affect children. We also have a pediatric council that meets with regularly with most of the payers in Tennessee, and what they do is they bring issues and items to those insurance companies and managed care organizations, and get relief for pediatricians on problems with coding and things such as that. So they meet with them once a quarter, and then we have a lot of publications. We do a lot of e-news. You can go to our website and sign up for our e-news. We have a monthly blast that goes out called the TNAP Brief, and we have a print newsletter that goes out to our members twice a year. The other thing that TNAP is very involved in is education programs, and FIT is one of those education programs, but it fits underneath some of the other education programs. So FIT is designed to help pediatric providers advance their practice in the most efficient and effective way, and also to help them economically. As you know, especially within the pandemic, a lot of our pediatricians have suffered because people were not going to the doctor. So we're trying to work with them to address that. We address, in FIT, we talk about quality, doing the right thing, providing the best service, having the best health outcomes, and quality is how practices are being paid now. So it's very important that they understand what quality is, how to effectively and efficiently improve quality, and how to engage their patients so that their patients are better satisfied and more connected to their pediatrician. So what do? We help them, we go in and do a training on quality improvement and help them develop an infrastructure of quality and to provide the best care for their patients, the best health outcomes. And as they're beginning to understand, it's helping them keep their doors open when they can hit some of those marks or the metrics that we help them collect. The other training programs that TNAP has, they have the Behavioral Health and Pediatrics program that does, it actually goes in and trains pediatric practices on behavioral health screening, coding for behavioral health services, psychopharmacology, in-office treatment, and then they connect the pediatricians' offices with the behavioral health referral resources in their area. So this has been a very popular program. We also have a foster care arm of the BHIP program that is working to develop some foster care medical homes. We have the EPSD&T program, which It consists of Bright Futures recommendations. It trains on the components of well-child visits, the business case for well-child visits, and coding for well-child visits. And it's done by our coding educator, Janet Smith. The START program is our screening tools and referrals training program that is TNAP's oldest program. It's been around over a decade, and we go in, the trainers are pediatricians, and they go in and train on postpartum depression screening, developmental screening, autism screening, coding, and again, referral resources. They work very closely with TEIS and make sure that the pediatricians know how to access TEIS services. So what we do with FIT is we usually have a conversation with a practice. They send us an application with some demographic information, and we do a survey about their practice culture and their quality improvement experience. And then we usually go into the office. Of course, we haven't done that this year. Actually, I'm going to go next week to start my in-office visits again, since I am fully vaccinated and have been for a while. So I'm going to be going to Knoxville and Smyrna to be able to do some in-person training. So we help them with understanding data, how to collect data, how to use data to improve their quality. They select their area of focus, and right now we concentrate on those three areas of well care, behavioral health, and developmental screening. So those are the areas of focus that they can choose from, and then we help them collect that data. They send it to us, and then we send them back reports. The practice culture really helps. It helps the practice, but it helps the trainer kind of know how that practice operates, and some strengths and some opportunities for improvement within the culture of that office. So we help them develop a QI team that has a provider, somebody from the administrative staff. We have to make sure we have someone from the nursing area or medical assistants, and then most practices don't have an IT person. If they do, that's awesome. We get them involved. We have gone to all automated data collection, so that our previous programs were all chart review, and it was very labor intensive for the practices. So we have a wonderful pediatrician who is also a computer programmer, who wrote some programs for us that allows us to analyze the data from their billing data or their EHR. So we give them, as part of their training, we'll give them their focus area evidence-based process changes that we know, if they implement appropriately, will help improve their quality. And then we teach them about data collection, how about having regular team meetings, and then of course our PDSA cycles. The Plan, Do, Study, Act cycle is well known across the quality improvement spectrum, and it's a very simple process, but it can make a huge difference when you actually plan something, implement it, see what happens, and then adjust accordingly. So that's all a Plan, Do, Study, Act cycle is, but it really can make a difference when it's done in a systematic manner. We provide them with reports. Right now, all of our programs are collecting data monthly. We have in the past done quarterly, but they get to see a lot of change over time quicker, so that their PDSA cycles can adjust based on what their data is showing them. So there's a sample of our well child completion rate by age, which we give back to the practices. This has been changed as of January of this year. We actually redid this because they changed the HEDIS measures, and TNCare is using these age groups to use with their PCMH program, so that's what the practices are being measured on for quality. So we're helping them out. One of the things that happens with this is they actually get a recall list of all the children within the past 12 months that have not had a well visit, which has been a huge advantage for the practices, because most of them are not able to pull that from their EHR, and they get a list from every insurance company with those kids that are due for their well care or past due. And so they're trying to work 3 or 4 lists. And what happens with this is it puts them all into one list, so they can be more efficient by working one list and trying to keep up with multiple lists. So that's actually new when we made these changes. So what is the value for the practice? It gives them standardized metrics that they can look at it, review, and adjust accordingly. It lets the practices know where they are. If you're not measuring it, then you don't know how you're doing. We have state level data that they can compare to. We have support for their QI efforts. We also share successes. We usually have a learning collaborative in the fall or by the end of the year, and the practices can share what they've done in their QI work. So we do have support calls. In fact, Carrie Virgo is going to do our support call, our next support call in May, which is the 13th, about the behavioral health safety net. So that's one of the things we try to find, or I try to find things that are of interest to the practice that they may not hear about otherwise. And because most of them are just so busy seeing kids and taking care of kids, they don't always get the advantage of those collaborations with other organizations. One of the huge advantages of the FIT program is Maintenance of Certification, Part 4, from the American Board of Pediatrics, and Quality Improvement Credit for the American Board of Family Medicine.
Got her stuff. I don't know if I can go out there.
These are required for pediatricians and family medicine physicians
Sorry, if you're not muted, can you please mute your phone? Sorry, Becky.
Thanks. That's okay. These are credits that pediatricians and family medicine doctors have to have in order to recertify for their board certification. So it's it is hard it's not hard for them to get this credit, but there's not a lot of quality opportunities to get this credit where it really is a positive thing for the practice. So our practices have been real happy to be able to get MOC Part 4 credit and quality improvement credit with ABFM. So we have pediatricians, but we also work with family medicine. We work with anyone who sees children. So that's the gist of our program. We have had some downtime during COVID just because everybody has had downtime, so we're picking back up. We're really excited about some of the new practices that are onboarding, and especially our new well care with the new metrics and the new recall list. So thank you all for allowing me to share with you this morning. If you have any questions, I'll feel free to answer those. I don't know if we want to stay on time, that we can hold them till the end.
I think we have time for some questions now if people have some.
I see some in the chat box. Hold on one second. Megan Gaylord She had sent TNAP an email earlier in the year to team with the Tennessee Suicide Prevention Network to introduce a training on suicide screening to their website. Do you have a good contact at TNAP that we could reach out to?
Casey Lamar is our marketing director, and she's the one that has works on the website. So it's her email is casey.lamar@tnap.org.
Do you mind to send me that in an email, Becky, and I'll share it with Megan?
Sure.
Thank you.
I had someone from Tennessee Suicide Prevention Network did the last support call for our FIT practices. So that was a really good opportunity for them to understand about all the training available through them.
Other questions for Becky? Okay. If there are no other questions, then we will we'll move on to our next presenter. Becky, thank you so much for coming and telling us about this. I really appreciate it.
Well, thank you for having me. We always like to get the word out about TNAP. We're really proud of the work we do. We always like to coordinate with other groups that are care about children. So thank you for the opportunity.
Absolutely. Okay, our next presenter is Melissa Birdwell from Frontier Health, and she's going to tell us about the Adventure Program. Melissa, are you ready to go?
Yeah, let me pull up my slides here. I think I can do that. And
if you have any issue, just let me know and I'll pull it up. Oh, there you go.
Sure. Yeah, I think we're good. Let's see how this part works. How's that? Can everybody see it? Does that look good?
Yes, we can see it.
Okay. I was like, oh, I've lost everybody in the process. So my name is Melissa Birdwell, and I am the Children and Youth Division Director for Frontier Health. Today we're going to be talking about a specific program that we have, which is the Adventure Program. And with the Adventure Program, we're specifically going to talk about some telehealth services that we have been providing. So first of all, let's start out with what is Adventure and what do we do there? So Adventure Program is what we call an IOP, or intensive outpatient program. With it being intensive, what that basically means is that the kids go there all day, every day, but they do go home at night. So you can think of it kind of like school in that sense. And it is designed for mostly kids about ages 12 to 18. And the kids there all have some kind of substance abuse or use issue, and most are also co-occurring, meaning that they also have a mental health diagnosis or behavioral diagnosis. So obviously, if the kids are going to be there every day, especially when we were talking in the pre-COVID days, that meant that they were missing school. So we do have a licensed special education teacher who's on site with us and is able to continue their education while they participate in the program. And of course, we work with other people in the community as well, probation officers, DCS, and certainly the families, so that we can ensure success for our kids. So the motto actually of Frontier Health is where people are important, and that's very true at Adventure Program. We want to see the kids come out of the program abstaining from alcohol and drug use, and we really want to build up that family system while the kids are there. The families are invited to participate, because we know that the problems aren't just the problems of the children, but the whole family as a unit. And this slide also talks about just the cycle of poverty and how we want to have an impact on that because we know it also impacts substance use. We have a case manager who is part of the program who will help families to find other resources and things that they may need. And the other thing I forgot to mention, the name Adventure isn't by accident, although it's a pretty cool name, but we have that because the idea of the program is also that we get kids outside. The location of the program is actually next to a park, so we have a lot of land that we can use. And we want kids to see that there is adventure in the world and there are things you can do beyond the alcohol and drug use. So that's just a little bit about the program itself and our goals with it. So obviously, I was talking about pre-COVID times, but we all know a year ago, the whole world changed. And we had to figure out a way to change with it. So in the beginning of the pandemic, all of Frontier Health's buildings actually closed briefly to clients. We still were serving them, but we were doing that strictly by phone. So in the beginning, we were calling clients individually to check in on them to do the phone therapy sessions or case management meetings. But thankfully, after a short time, we were able to obtain the equipment and I will say the technological know-how to start doing video teletherapy. So we used Zoom as our method for providing that. And so once we moved into Zoom, we were able to do individual, family, and actually group as well sessions virtually. And at first it was only virtually, nobody was still in the buildings. Everybody participated through Zoom. Now at the same time, of course, the schools in our area were all virtual as well. So that made it a little easier because the kids could still do their schoolwork just as their peers were doing at home. But our teacher would still follow up with them. She would help out with any problems they may be having. And she also sent supplemental materials for them so that in some cases they could actually get caught up on some of the work that they were behind in, especially during the summer when schools were closed. Then we were able to reopen to clients coming in person. And so at that point, we did a hybrid model where we would have some kids who were participating in person in the building and some kids would be still participating by Zoom. So clients who were, unable or just maybe uncomfortable in coming into the office could still participate because they had the Zoom capability. And this was also really important for our group homes in the area because usually the group homes would send the kids over who needed adventure program. But in the case of COVID, that wasn't really ideal, so they were able to participate by Zoom as well. So what were some of the benefits that we saw by using a hybrid model or incorporating Zoom into what we were doing? And I will say there were a lot of benefits. What you're going to see is that I actually listed more benefits than I did challenges, but it's something that I hope we can continue even post-COVID. First of all, I hope there is a post-COVID, and I hope we can continue to Zoom because here's what we found. We were able to kind of shorten the group duration to allow breaks for clients. I'm sure if you guys are also doing a lot of teleservices or meetings, you know that it can get strenuous. So we kind of broke up our time. We were able to do breaks, let them stretch, let them look at something else besides the screen for a little bit. And we didn't necessarily have them just on the screen all day. We also were able to maintain the program, especially during the time of COVID, with the utmost measures of safety being at the forefront. So we were able to keep people at home safe and still participate in the program that they were needing. And as I said earlier, we were able to serve those kids in the group home because group homes were very hesitant to have kids leave because the last thing you want is COVID to start in the group home, and we know it's going to spread quite easily. So the kids were able to stay there and they could connect to the facility via Zoom. So that was a huge help for them. We were also able to continue serving kids who left the area because of different kinds of placement changes. And it enabled them to be able to finish the program, whereas in the past they would have had to be transferred to another provider. And while that's great, it does mean starting over in some cases or just trying to build that rapport and get back to where you really were. So one example, we did have a young man who was in a group home, He was pretty close to graduating from the program when he was sent back home, which is a wonderful thing. We want to celebrate, but we did want him to be able to complete the program and to work with the family that he was returning to. So we were able to continue serving him despite the fact that he was well outside of our normal catchment area. So I was very happy about that, and that was one of the big successes for continuing to do a hybrid model. We were also able to get grants to provide the technology to the clients. Obviously, that's one barrier, that some people did not have the means to participate by Zoom, but thankfully through the grants we were able to provide that for them so that they could participate. And then another benefit was that we can serve clients who otherwise wouldn't be able to attend. And that can be for lots of reasons, even beyond COVID. So if somebody had specific transportation issues perhaps, or limited family resources, or maybe a different kind of illness in the family. We had another person who was able to participate despite having another illness that would have prevented them from coming if we were strictly in person like the old days. So it was really good to be able to serve people for lots of different reasons who couldn't come. But of course, as with anything, there were also some challenges. It's difficult actually to engage teen clients by Zoom. And on the surface, I think that sounds counterintuitive because we assume that if anybody is used to computers and screen time, it's probably our teens and younger kids. And while that's true, it's that engagement piece, though, that's still a little bit difficult. They, I think, felt a little bit less a part of the program, especially in the beginning when it was fully virtual. And they were kind of missing the structure of that full day program that we can provide for them, because the rest of their day around their home schedule wasn't necessarily a routine and a schedule like we would have had they been in person the whole day. And they also didn't have that same peer interactions. So while they were obviously in groups with their peers, you know, when you're in person, there's all these side chats that happen, and on your way from class to lunch, there's side chats and things like that. And so I think they missed some of that. That can be pretty important. Accountability was another area that we noticed that was really difficult with video telehealth. Sometimes, you know, for example, if a video is not working, then we can't see the kids. We don't know if they're participating, really, if they're paying attention. They could be doing anything. We wouldn't necessarily know. Drug screens, that's a part of what we do at Adventure Program to track how they're progressing through the program. And obviously, when we were fully virtual, that became very difficult to do as well. Some of the unscheduled and unplanned peer accountability is also missing. The nice thing about group is that the peers will hold each other accountable, but again, that looked a little bit different when we were doing the virtual services. At the time when we were only doing virtual, attendance was actually poor too. We did see improvements, however, when we went to the hybrid model. So I really think just having that little bit of time that they were able to connect with staff in person did make a difference, because most of the people who were still during hybrid participating by Zoom had at least some form of a limited interaction at some point with the staff in person. So I think that did make a difference. And behavior management was something that we had to kind of adjust to. It's a little bit different when you don't have somebody sitting in front of you. Clients obviously during a group, for example, could be placed back into a waiting room if they became too disruptive, that sort of thing. But the problem is the ability to face those adversities head on and have kind of those teachable moments was missing. If somebody is having that same difficulty in a in-person group, you know, you might have the ability to have another staff pull them out, speak to them individually and bring them back. But that gets a little more complicated during a Zoom group. And clients, let's face it, they can turn the sound off. They can turn off the video if they don't want you to see what they're doing. And again, accountability is a little bit tricky on that. But overall, I definitely think that there is a place for at least a hybrid model, just because of the ability to continue to serve people who otherwise may go without services for a number of reasons. I do think we've learned a lot over the past year, and so I hope that this is something we can continue. We can continue to learn and continue to reach people. But let's end that one, and let me stop sharing, and let's see if there's any questions or comments. Well, if not, I thank you guys for your time and the ability to talk about the program, and I appreciate it.
Thanks so much, Melissa.
You are welcome.
Let me see. Oh, I see a chat. Let me see. Oh, Ava said thank you, Melissa, as well. Ricky or Lindsay? I think Ricky might be on mute.
Hey Kirby, it's Lindsay. I am here.
Okay.
Trying to pull back open the agenda. I'm not sure if Kirby has any, or not Kirby, if Ricky has anything else that she wanted to share with the group. But yes, Melissa and Becky, we definitely appreciate y'all sharing all the information this morning. I really wish I'm in West Tennessee in Memphis, and I definitely wish there was a program similar to yours, Melissa, over here. I just think that it's just something a little bit different. I think the kids definitely probably enjoy, but it's a little too far this direction. So, but it's a great service for sure.
Thanks. Yeah, it is a little bit unusual, but we're happy to have it.
Wonderful. Does anyone else on the call have anything that they want to share with the group? Any announcements? This is a quiet bunch today.
I know. I was just thinking the same thing. I'm like,
is anybody there?
is everyone this quiet or are they stuck on mute? Oh, here's Ricky. She just joined. She must have had to sign off. Okay. Okay.
Rick, you're back?
Technical difficulties.
Gotta love it.
Okay. I see you're here.
Well, I don't have anything, I guess, additional to share. I know we sent in the needs assessment last month, which feels like forever ago already. So thank you for y'all who sent in information for that. I'm sure we'll be talking about it in the months to come as that progresses through. Is there anything else that you think we need to share?
I think I heard Ricky.
Oh,
Sorry, I think I got muted on the other end. I was unmuted, but y'all couldn't hear me. Sorry about that. But anyway, I was just going to ask the group if there was any new programs or items of interest that they wanted us to reach out to see about presenters for our next meeting. I know Carrie's on the call, or was. Carrie, is it too soon to talk about the SoCal expansion at our next meeting?
No, I think that would be great. We would love to discuss that with everyone.
Okay, awesome. Awesome. Anything else, y'all?
I was just going to share that Region 6 Children's Committee recognizes the need for kids to get outdoors and to do some very specific outdoor stuff. So our initiative for the next few months is to work with our Parks Department over the summer to hold kind of like outdoor play days with the goal of addressing some children's mental health stuff. So I just liked that it tied in very nicely to the program that we have out east. that focuses heavily on mental health and outdoors.
Awesome.
Thanks, Megan.
I don't know if it would be helpful, and sorry, Carrie, I'm picking on you today, but would it be helpful to have someone talk about the safety net with this group at our next meeting, the children's safety net?
I think that could be beneficial as well, purely
Yeah,
because our criteria is expanding.
oh, okay,
And I think that could be really helpful for folks to know.
absolutely, okay.
Ricky, you definitely took that right out of my mouth. We've been talking a lot about that in Region 7 and just kind of over here in the Memphis area, trying to promote that and educate people about it. So it'd be interesting to hear kind of across the state who the providers are and what that's looking like for sure.
Absolutely, and I would advocate as well, maybe for this group, after we learn what we can about the safety net and some of the eligibility, as you said, Carrie, maybe some expansion on eligibility, but maybe as a group, we could look at ways that we can help promote this to families, because I think the biggest thing for us now as advocates for children is to make sure that children who need this know that it's an option, and that piece is very difficult, obviously, to get this information to the right places. So as a group, if we can help spread that word once we learn what we learn, I think that would be a really important first step for us as advocates.
I agree, Ricky, because I feel like I know, I mean, just doing the work, I know there are a lot more families out there that really could benefit from safety net that probably don't have any idea that it's even available to them, which was part of the reason we teamed up with Becky to let pediatricians know as well. So yeah, anything that we can do, I'll make sure that Katie can join us and we'll get everybody the one pager. And the criteria has expanded and that's been announced. So just know at this point, if folks have private insurance and it is not covering their behavioral health components, they can be taken into the safety net. And in addition, if they are on Cover Kids, they can actually receive safety net as well.
Wonderful. That is awesome. Well, and in light of the fact that it is Children's Mental Health Awareness Week, I encourage everybody to share information and content on their organization's social pages or websites. And this is a great one to promote that there are services available for those who cannot afford them or do not have access to them. So thank you guys so much for being here and being a part. And now I'm really looking forward to our next meeting too.
Hey, Ricky, can
Yeah.
I throw something in there about children's
Please.
mental health awareness?
Yes.
All right, y'all. So, I mean, since we're all on here, might as well take an advantage of letting you all know that the department staff, we have split up the month of May into 4 different weeks. This week we will be focusing on infant and early childhood, which Melissa Binkley and her team kicked off on Monday with an Instagram takeover of the department's Instagram. They will be doing a virtual tour of RIP. If you've never seen the building, it's amazing. And they'll be doing that on a Facebook Live on Friday. Lots of events going on. The second week of the month will be focused on school-age children, the third week, youth and young adults, and the last week on system of care. So there's lots of things going on. Facebook Live, Instagram. I see Melissa Binkley's typing, so she's probably going to give us a list of what she's getting ready to do this week. She's been doing a lot of great stuff. But we're just encouraging everybody, you know, to continue to celebrate, wear your green. We will be hopefully, and I know your folks, Ricky, have been working really hard. We did get a proclamation from the governor for children's mental health awareness, and we'll be working to get all of the major bridges and monuments in the state turned green. So Yes, Melissa, they're doing Rip Talks. I'm so excited about it. So there's also the National Federation of Families has a video contest going on. If your youth and young adults want to get out there and create videos, it's an awesome thing to do. And I believe our very own Elizabeth Setti-Reeve will be presenting to the institutes. They will be having all day Thursday and Friday, I believe, and they will be having lots of different education events. So please make sure that you check out the department's Instagram, Facebook, the SOC across Tennessee is also doing a lot of social media as well. So just wanted to throw that out there for everybody.
Thank you so much for that. Y'all please share the department's content and get the word around. It's very helpful. Anything else, other announcements or things that you all want to share?
I just posted a question in the chat box, but I'll just ask so we don't miss it. Did I hear someone say that a youth who has private insurance can have access to safety net to cover their mental health needs?
That's
in
correct.
addition to uninsured? Okay, I'm sorry, go ahead.
Yeah, that's correct. You heard that right.
Okay, that is very good to know. Thank you.
Other questions or announcements? Okay. Well, y'all have a wonderful week, and don't forget to celebrate Children's Mental Health Awareness at some point in the month with the department. Thank you, Carrie, for that.
Thank you, Ricky and
Thank
Lindsay and everyone for joining. This is Avis. I appreciate you all so much, and everybody have a good rest of the week.
You too. Bye-bye.
Bye, all.